All right. Well, for those of you who haven't joined us before, want to share a little bit with you about the Grandfamilies and Kinship Support Network. We're the first and only National Technical Assistance Center on the families. And so we work with states, tribes, territories, nonprofit organizations around the country to help you all improve services and supports for the families. And that's where this webinar, Trauma-Informed Care, comes in. We have 5 national partners with whom we do this work, one of whom is 0 to 3. So we're very pleased to have them today with us. Know that we have a very robust website, which is gksnetwork.org. You'll see at the bottom of this slide the URL. We list all of our past webinars, past recordings of those webinars, current webinars, upcoming webinars. We have a lot of rich professional development resources that you can refer to on our website. We also disseminate and we have awarded many exemplary kinship programs designations and many kinship program practice designations around the country. You can go to those and see what you want to replicate and how we can help. And you can ask us any questions at any point. All of our assistance is no cost. So you'll see on the bottom left a link to a short form where you can ask for assistance, big and large, big and small rather, big and small. And we also do some bridges. We do some more intensive technical assistance in 3 jurisdictions, and lessons learned from that project is going to be coming out by the end of September. So stay tuned for that and how to bridge systems for kinship families, because as we can see on this slide, there are many systems that impact the families. On this slide, you can see that this webinar is going to be supplemented with 2 learning community sessions. These are going to be more interactive in nature, and they're going to be capped at 100 people so that there can be more interactive. One will be with Dr. Sherman, and the second one will be with Dr. Joseph Crumbly, whom I'm sure many of you know. He is also one of our subject matter experts. So thank you again for joining us today. And it's my pleasure to turn it over to Rebecca Parlakian, who is one of our partners at 0 to 3. Rebecca?
Hey there, I just needed to unmute. Hi, everybody. We're so thrilled to have you here. And I am deeply honored to introduce you to a colleague of mine. And his name, Dr. Mike Sherman. He had 0 to 3 is the Infant and Early Childhood Mental Health Clinical Consultation Manager for our Safe Babies program here at 0 to 3, which focuses on meeting the needs of infants and toddlers who are child welfare, involved in the child welfare system along with their families. And my wonderful colleague Mike is a licensed clinical psychologist and a Napa UC Davis infant parent mental health fellow. He's also an expert in the field of infant and early childhood mental health. And for more than 15 years, he's worked at the nexus of community initiatives, health and child welfare programs. He's done direct service, supervision, training, consulting, program development, and program administration and leadership. His training and clinical practice and leadership experience have given him a truly deep understanding of the needs and barriers in our systems of care. At 0 to 3, as I mentioned, Mike works for Safe Babies, which is a program that is broadening the capacity of providers, programs, and sisters to nurture children's early development in all domains. I am so thrilled for you to meet him today and for us all to have the chance to learn together with him. Mike, take it away.
Thank you, Rebecca. Hi, everybody. So I'm incredibly humbled and excited about the opportunity to connect with all of you and to have this conversation with such an amazing group. Let me throw slides up and we will get going in just a moment. Okay, does that look okay for folks?
Yes.
Fantastic. All right, everybody. So yeah, we're here today to talk a little bit about trauma-informed care for kinship and grandfamilies. What do we need to know about the little ones and the medium and big ones ultimately that we all care for and support? And how do we understand sort of the experiences that they've lived through, oftentimes before they come into our care? How do we make sense of that? How do we best support them? How do we think about the considerations that are important for us to consider, even about ourselves as we come into contact with children, young folks who've experienced some pretty difficult things? And so this conversation really begins with our foundational understanding of child development. One thing that's important for us to understand is throughout the history of humankind, all development has happened in the context of relationship. As human beings, we've survived, thrived as a result of the fact that we have each other. Not because we have thick armor plates or sharp fangs or we're stronger than everybody else, but really because we can meaningfully connect and support and achieve outcomes that are greater than the capacity of any one of us in order to navigate our environment, to deal with hardship, to overcome difficulty, right? And all of these are our evolutionary gift, right? Our ability to navigate the world is strengthened by the relationships that surround us, ideally. A part of that is also that our development occurs in the context of those relationships. And early on in our lives, throughout infancy and early childhood, really over the course of our first 3 or 4 years, our brains are going through an incredibly rich and robust process that means that there are over 1 million new connections developing every second of every minute of every hour of every day of that child's life. And those connections guide and strengthen our ability to think, our ability to form relationships, to navigate the world around us, to make sense of the things we experience, to learn, to grow. And ultimately, at the end of the day, it's not just our cognitive abilities and our emotional abilities, but it's also our physical health that's guided by this early brain development. And so the richer our early experiences are, the stronger our brains become. And again, it's incredibly, incredibly important for those early relationships to buffer and strengthen that growth. When we think about why the early years matter, there's a lot that happens during those first few years that, as we've said, sets our brain up for development and growth and functioning. And at any point in our lives, right, for those of us who are in this meeting today, if we think about our lifespan, the things that happen to us between our conception and our first birthday have a greater impact on how we feel, think, behave than the rest of our lives combined, right? So conception to one accounts for more in our overarching functioning as adults than the rest of our lives combined, whether we're 25 or 85. And the reason for that is that those early experiences set the foundation for how our brain develops. And our brain then governs every single thing we ever do, right? Our functioning, our health, the way our endocrine system works, the way our body metabolizes the foods that we eat, how we think, how we relate to others, how we problem solve, our avoidance or engagement with challenges, right? All of those things are prompted and develop as a consequence of how our brain develops during those early years. So it's really, really an important consideration for us to weigh. So our early experiences guide how our brains develop, and our brains inform how we see ourselves, others, and the world around us throughout the rest of our lives. So when we think about young children and older youth who come into contact with stressful events early in life, that informs their development. That informs how they then perceive themselves, how they see their relationships with the people around them. And in large part, that creates the lens through which they view the world around them for the rest of their life. Right? That presents both an opportunity and a challenge. Certainly, we understand that what happens early on is important, and if we can enhance the quality of those early experiences, that's fantastic. And sometimes we meet children and youth when those experiences have already happened, when those challenges have already occurred. And so again, the relationships are ultimately the cure. How we surround them with nurturance, attention, love, empathy, attunement is going to guide the rest of their lives and how they develop. And the earlier we can get into place to do that, the better the outcomes are going to be. So let's spend a little bit of time talking about this idea of stress versus trauma. How are these ideas different? Where do they overlap? How do we understand? What's the difference between stress and trauma? And you'll see a range of resources that are tagged today that you'll see once again later on. Resources that we share with you from National Child Traumatic Stress Network. And so we're kind of drawing from some of their resources to really begin to think about how does stress and trauma interact? What is the relationship there? And they are related. Stressors can become traumatic, but not always. And how are they determined? Right? So understanding that difference helps us provide the appropriate support, not just to children and youth, but also to those caring for them. So let's start by really thinking about stress. And stress is defined in the literature as really three different types of stress. Every time I start having a conversation about positive stress with a group of people, and I'm saddened that I can't see your faces right now because I think there would be some interesting looks people are giving me. And folks typically say, well, what do you mean positive stress, right? I felt stress before, it has never felt positive. I don't know what you mean. And so positive stressors are moderate, short-lived, typical experiences, right? They're normal and a necessary part of every person's development. These can include things like an adult setting a limit. These can include things like me giving this presentation right now, right? It's a positive stressor because the way I think about what I'm feeling, my body is activated, right? I'm experiencing probably a little bit of a higher blood pressure than usual. My heart rate is up. I'm excited to be presenting this content. I'm in an audience that includes people that I know, and that's helping me co-regulate a little bit. I have a lot of passion for this field, and I feel like the thing that I'm doing is of value to the field. And so it helps me modulate that stress that I'm feeling and have thoughts about it that are positive, right? So these experiences can be taking a toddler to a preschool setting for the first time and them starting to explore and navigate their environment and learn what the limits of that space are. Who's here to support me? How do I interact with other kids? How do we start to exist in the same space together at the same time, right? These are things that we want to support children in navigating, but ultimately they're helping us learn, they're helping us grow, develop new skills. When we go up that spectrum, we get into tolerable stressors. These could be more severe and long-lasting events that produce a pretty elevated stress response, right? Physiologically, your body is responding to a pretty severe thing that's happening around you. The reason that these events are tolerable is that they often occur in a time-limited sense, right? Something bad happens, and then we get to recover from it, right? The other part is oftentimes they're buffered by the presence of caring, supportive adults in our lives. So these could be big events. This could be parental divorce. This could be homelessness, natural disaster, a car accident, a serious illness of a loved one or a family member. All of these things can be tolerable if they happen in the context of buffering adult relationships, and if there aren't too many of them happening at the same time, which is what really differentiates this experience from toxic stress. The toxic stressors are strong, frequent, and prolonged exposures to adversity. Oftentimes, we encounter children and youth and adults who've had experiences of numerous things happening all at the same time on top of each other concurrently that are significant adversity factors. A lack of access to food and shelter, a lack of tangible resources necessary to exist in our society, the exposure to neglect or abuse of some form, community violence happening at the same time surrounding that family's home, right? So all of these things happening at the same time, and often they happen in the absence of meaningful buffering from an adult caregiver, either because those caregivers themselves are so overwhelmed by all of these things that are happening, or because they're dealing with their own challenges, right? Whatever form that takes. And this level of constant stress really disrupts the development of our brain. It alters how we respond to stress. It creates a system that is very hypervigilant. Very small things lead to very big reactions because our brain learns that we can't prioritize exploration or curiosity. We have to prioritize safety. And anything that's new, that's unusual, we don't have an opportunity to pause and think about, hey, is this going to be good or bad for me? We have to react in a big way to keep ourselves safe, right? And so we start to see that hypervigilance and the big significant responses to things that we don't think should provide ample reasons for such a big reaction. Okay? But what we don't know oftentimes is what brought this youth to where they are now, and how have those experiences created a brain that's learned, hey, I need to keep myself safe in these moments, not worry about whose feelings I'm hurting, right? Which is difficult to deal with. But also approaching it with empathy and understanding allows for us to have a little bit of a different strategy. And so I think the one thing I hope we all take away from our conversations today is that relationships matter. Right? It's the relationship, even more so than the actual event, the actual stressor, it's the relationships that determine whether something is going to be traumatic or whether it's going to be tolerable. Right? That's often the differentiator. And so, what is trauma? How do we dive deeper into that idea? When we think about trauma, a definition that 0 to 3 uses is this is an exceptional experience in which powerful and dangerous stimuli overwhelm our developmental and regulatory capacity. So let me break that down before we get to the part that comes after the and. We're exposed to something in our environment that is bigger than our ability to deal with it. This could be, again, an earthquake. This could be our parents losing their job and us losing our home. This could be domestic violence. This could be abuse. The issues are too large, too complex for us to deal with and for little children to deal with. And so the brain goes into a state of dysregulation. I don't know what to do. I don't have a good answer. And the child has insufficient resources to cope with the event, and those resources include both what the child brings within them, their problem-solving abilities, their strengths, their resources, but also what surrounds that child. Are there meaningful supportive relationships, right? When something goes wrong, is there somebody safe that I can go to that is going to be there for me? That's going to help me make sense of what happened and help my nervous system settle back down, right? And for those of us who are fortunate enough to have those people, that's a significant resiliency factor. And that's one of the biggest resiliency factors, is having at least one person in your life who's attuned, well-intended, well-regulated, and available. If we have at least one of those, we do a lot better dealing with stress, dealing with difficulty and hardship than if we don't. And when we start to unpack the different types of traumatic experiences, there also are different types, different degrees to which trauma can impact them. The first is acute trauma, right? These are single incidents, a single distressing event that's often happening in a short time period. Natural disaster, car accident, medical emergency, your home being burglarized, right? There's a loss of safety, there's a loss of control, but oftentimes we can recover from these things if, again, especially if we have people around us that are caring, nurturing, supportive. These in research are really referred to as big T traumas, capital T traumas, right? Single events that occur, we work through them. Sometimes we might need some support. Sometimes we can navigate them without any significant deterioration in functioning. But ultimately, something happened, time has gone on, and for the most part, these are things that are processed more quickly, especially in the context of therapeutic treatment. Chronic trauma is a little bit more pervasive, right? Repeated or ongoing exposure to events that are very distressing. This could be anything ranging from bullying, homelessness, ongoing community violence, issues that exist that put us in a position of we're being threatened, and again, lacking in sufficient resources to effectively deal with the challenge, right? For a very young child, that could be somebody at school poking fun at you, and you just don't know what to do, and you tell them to stop, but they don't, and you go tell your parents, and they're too busy, and they have their own things to deal with. And you sort of tell your teacher, but your teacher's overwhelmed and doesn't know how to manage it. And so you're left dealing with this on your own. And again, in the absence of that support, that stress continues to pile on and pile on and pile on, and it has an impact on our development. Complex trauma is really what most therapeutic approaches are focusing on, especially when we think about early childhood mental health. We're thinking about trauma that happens in a relational space. These are repeated exposures over an extended period of time that happen interpersonally, often beginning early in life. That interpersonal piece is, it's not just, oh yeah, there's somebody that I don't know that is bullying me at school, that I don't have a close personal relationship with. It's actually somebody that lives at home with me. It's somebody that's a part of my family. It's somebody that as a young child should be taking care of me, and instead, the way they're showing up is actually causing harm. These things include emotional, physical, and sexual abuse, can include intimate partner violence, right? Even if you're not the target, having that happen within your household is likely to be traumatic for young children, right? And oftentimes even for older youth. there's a very different sense of not only is this threat, this harm happening more localized, it's happening within my home, it's happening within the close, meaningful relationships that I have, it's happening over a long period of time, but I also don't get to leave it as easily, right? If there's a challenge that's happening at a local park, I can choose not to go to the park. But if the challenge is at home, where can I go to find safety? Right? It becomes a very different question. And it's more significant in terms of experience, in terms of impact, in terms of requiring a sort of a larger scope of therapeutic support to make sense of that, to process it. Because oftentimes you're working with the child, but you're also working with the people within the family who might also be impacted, might be sort of unintentionally or intentionally contributing to the traumatic experience, all of those things, right? So much more complex. What happens, right? So how do children make sense of traumatic experience? What can we as people who care do? What can we look for? What are some signs that something might be happening here? Right. And so it is important for us to consider this along a developmental trajectory. Younger children are going to have different reactions to different things, right? Than adolescents, than school-aged kids. So depending on where a child is in their developmental trajectory, at the time when they encounter a potentially traumatic experience, we're going to see different responses, different reactions. Right? And for us, we want to speak the languages that children present their challenges in. Right? Oftentimes, we see behavior and we know to look for behavior and we try to address behavior, but often we don't pause long enough to think about why the behavior is happening. And for very young kids, those behaviors look very similar regardless of the why. And again, if we just treat the behavior, if we focus on minimizing it without understanding why it's happening, oftentimes we just get a different behavior that replaces the one we just worked to get rid of because we haven't met the underlying need. We've just addressed the surface level behavior. So what are we thinking about? We're thinking about how old is this child? Very different for a 6-month-old, a 6-year-old, and a 16-year-old, right? How they're going to demonstrate that they're in distress. We also need to think about not just the chronological age, but the developmental level, right? If we have a 12-year-old, but we know that due to them having Down syndrome or another condition, the developmental level for this 12-year-old is actually closer to 4 or 5. We have some different considerations we need to make, right? It's not just chronological age. And we also have to think about what is the support that's available in the context of what environment are we seeing these behaviors? Are we seeing this child striving to function? And so let's break it down a little bit. When we think about infants and very young children, birth to 2, right? One of the things that we're going to see start to show up, and none of these guarantee that there's trauma. What it does tell us is that we should take a deeper look. We should continue to stay curious, continue to explore, right? So if we have a child that's either over or under reactive to the people in their environment, if we have a little one that's crying, can't be soothed, is having a lot of difficulty falling asleep, is having a lot of difficulty being picked up and held, what's going on, right? And it could be a really bad case of acid reflux or GERD, right? It could be that there's an allergy or a medical condition that's happening. It could be that we have a developmental condition that's underlying some of this. We don't really know, but we do need to look deeper. We need to explore. We need to consult and gain feedback from others and continue to look pretty closely to try to figure out what's going on. Young children can definitely show up with a difficulty forming secure, positive relationships with their caregivers. We're going to see impact on their activities of daily living. And for an infant, sleeping, eating, going to the bathroom are essentially their activities of daily living. So what do those things look like, right? Qualitatively, if we know that a child needs to be rocked for an hour and a half before they can fall asleep and they're crying the entire time, what's going on? Again, it doesn't mean that there's trauma, but something's happening, and the child and family are at risk for further decline without receiving some support. Are we starting to see some delays in meeting developmental milestones? And again, the eyes can't see what the mind doesn't know, right? So for us as supporters of children and their caregivers, what do we know about typical and atypical development? When should an infant start to track objects in their environment? When should we see a child beginning to roll over? Are they making eye contact? Are they not? Right? All of these things. Are they starting to develop words and vocalize by the time they're 14, 16, 18 months, right? What's happening? And so all of those things are opportunities for us to look, because infants don't advocate for themselves by telling us, hey, my back really hurts. But they do tell us through their behavior, through their activity or lack thereof, right? So it's on us to learn their language and how they communicate rather than waiting for them to get old enough so that they can tell us what's really happening. When we think about preschoolers, right? So we go back to that idea of hypervigilance that we mentioned earlier, right? We have maybe a 3-year-old that's very focused on what's going on outside. And it's not that they're distractible, but they're having a panic attack every time somebody walks up to the door. Right? What does that mean? They're having a hard time focusing on what's happening in the classroom, on the things happening with their teacher and their peers, because they're so preoccupied with, hey, I'm in danger if somebody comes into this classroom. Regression or losing a skill that's previously been developed, right? So we have preschooler that's starting to go to school, and they were potty trained beforehand and they were okay through the first couple of weeks, and all of a sudden they're having lots and lots of accidents. Does it mean that there's trauma? It might, but again, look deeper. Right? Challenges with sleeping, significant changes in behavior patterns. Sometimes we'll see young kids reenacting trauma through their play, right? Whether that's physical activity, right? And where the toys are just repeatedly engaging in physical fights. Again, doesn't mean that that's what's happening at home and they're reenacting it, but it could. And so do we look closer? Do we stay curious and follow up? And then spikes in separation anxiety, right? Some of that might be developmentally appropriate. Some of it, again, if a child has separated and they're okay and they've adjusted to the new environment, and all of a sudden they're clinging to their parent's leg as the parent is trying to leave, what's going on? Right? Responding to that with curiosity is really, really important. Wanting to know more rather than just, it's just a baby being a baby or just a toddler being a toddler. That's oversimplifying. When we get to school-aged children, sometimes they walk around with a very deep sense of worry. They're very concerned, right? I've worked with children who are so worried about what's happening at home when they're not there, because there is domestic violence happening. There are some unsafe things happening at home. And so they're thinking about their mom's safety while they're at school rather than thinking about what's happening in the classroom. A significant experience of guilt or shame or self-blame. I mean, we've likely heard about this idea of sort of survivor's guilt, right? If a youth has been in a car accident and somebody in their family did not survive that event, feelings of blame, feelings of shame and guilt, right? If only I didn't distract the driver, right? Then this wouldn't have happened and it's all my fault. Things along those lines. A lot of somatic complaints, headaches, stomach aches, a lot of that anxiety plays out in tension within the body, tension throughout the body. Difficulty concentrating. This, I think that pretty much anything can produce concentration challenges when a child is struggling, right? And do we know, is this a learning disability? Is this attention deficit? Is this something's happening with the child's relationships in the classroom and they're distracted? Is it something's happening at home? And there's a carryover effect, right? Maybe it's not trauma. Maybe the family's really concerned about events in the community and there's community violence. And so the child's having a hard time falling asleep and they're getting to school tired. But could it be that there's something difficult happening at home that's or somewhere else that's producing concentration issues? Absolutely. We need to look deeper. Social challenges, especially when all of a sudden we're seeing a lot of difficulty with peer or social behavior, where before it was okay. And again, difficulty sleeping, right? So that preoccupation and nervousness and just the difficulty settling down the nervous system. Once we get into adolescence, again, developmentally, a lot of these are attempts to process the same internal experiences in more complex ways. So being self-conscious about what you're feeling. Is it okay that I feel this way? Do people know, right? There's a lot of focus in adolescence about being the focus of attention and what that feels like if you feel different than your peer group, for example. Feelings of anger, talking about revenge, right? Well, somebody did something to me or to somebody I care about, and so I need to get back at them. And what do I do with all those big feelings? Really a significant shift in beliefs sometimes, again, can signify that something might have happened that produced that big shift. Really a adverse reaction to feeling vulnerable, right? I'm not safe in this world. And so if I'm even being asked to volunteer an idea that I'm not sure of in class, that takes some vulnerability and I might have a really big reaction to that because I just don't feel safe enough in my body, not even starting to think about sharing ideas with others that I might be laughed at or told that I'm wrong, right? And then also, again, a part of it is reenactment, a part of it is asserting control over themselves and their environment, but engaging in higher risk-taking behaviors is something that can be seen, whether that's, drinking, pursuing substances of abuse as an attempt to cope, whether that's not really caring about their own physical safety and doing things that are risky. Some of that shows up as well. It can be a sign of trauma. When we start to think beyond that, again, relationships, right? We're centering this entire conversation on relationships. So what does trauma start to look like in kinship caregivers? Right? Because there's a parallel process. If something a child that's in your care is going through, that impacts us, right? We're in a relationship with them. We care about them. We carry perhaps some more multi-generational beliefs and experiences that show up in that moment. So ourselves feeling overwhelmed. This is a lot. Right? I've worked with numerous grandparents, great grandparents who said, you know what, I wasn't planning to take care of this 4 or 5-year-old in my 80s. That wasn't my plan. And this is a lot. Child welfare visits and going to doctors and dealing with school, and my body is not as responsive and limber as it used to be, and I'm chasing this little guy around that's all over the place. That's a lot. Anger, resentment, right? Again, kind of those two go hand in hand. Sometimes we fairly common experience of sadness, depression, right? That overwhelm kind of bleeds over into feelings of this is too much for me. There's nothing I can do about it. hypervigilance, even for the adults, because we're worried about the safety of those in our care. We also are a little bit out of control. We don't have the ability to decide how everything looks. And so we are on the defensive a little bit more as a response to that. And again, thinking about multi-generational effect. You know, gosh, 15 years ago, I worked with a set of great grandparents who were raising this little guy in their care. And so they reflected on, I was their therapist at the time, and they talked about, well, we raised our children, and then they raised their children, or tried to, and resulted in us raising their grandchildren. And now those grandchildren had their own kids, and now we're raising that one too. So what did we do wrong? What happened over these generations, right? And so they carried a lot of guilt as a result of what the subsequent generations of their family experienced, and needed to work through that because that was showing up in their interactions with this little guy who was by and large doing okay, but they had a lot of big feelings. And he had a lot of big feelings. And we were responding to what happened sometimes 20, 30, 40 years ago, rather than what was happening in the moment here and now. Right? So those multi-generational pieces can be quite complex and can drive a lot of behavior, especially if we don't attend to it. Thinking a little bit about reminders of trauma and loss. Want to expose us to this consideration. What are these? What are trauma and loss reminders? So these can be dates, these can be activities that remind us of something in the past. And sometimes it's a memory, and sometimes it's just our body responding in the moment. That sense of threat, that sense of dread, right? Something bad's about to happen. Why? We don't even know, right? It's our unconscious mind processing all of the information around us and trying to keep us safe. So sometimes it's a really conscious process, and sometimes it's not, right? But it's important for us to understand that especially for those who have prior experience of trauma or their caregivers, we might be unaware of the connections between what's happening in our current environment and that original trauma that's in the past. And if we're unaware, then we tend to react and respond to what's happening right now without all of the context for why it's happening. And sometimes that doesn't work out very well. So when we think about trauma reminders, right, these are things that our brains connect to a traumatic event that can include sounds, smells, situations, feelings, or even people, right? Some examples for this. If I smell smoke from a fireplace and I'm reminded of a house fire that happened when I was very young, that might not be, I mean, that can play out different ways, right? I can have an active memory and I'm like, oh, wow, this is a lot. It's reminding me of that fire we had when I was really little. Or it could be, I don't know what's happening, but we're sitting here by the fireplace and I'm having all of this anxiety and I'm panicking and I can't sit still. I feel like I want to run out of this room and I don't know why. Right? And so again, conscious or unconscious processes that are playing out. Some of these things are the way our body reacts. So having a rapid heartbeat during exercise, right? We're just working out, our pulse is getting higher, and that reminds me or triggers a felt sense of panic because the last time I felt really like my heart was racing when I was in a car accident when I was younger. Sometimes it's visiting a location where a past incidents of abuse have occurred. Right? And so this could be during a visit, this could be a person, this could be a location, could be lots of different things. Could be somebody that looks like a person that we had a negative interaction with, right? All of these things sometimes are not very clearly understood even by the person experiencing them. But it helps us to wonder about, right? I wonder what happened. My 12-year-old that I'm caring for had a really big reaction. I don't understand what caused it. Made me feel sad, made them feel sad after they calmed down. And I wonder what that was about. Because more often than not, there's something that produces that reaction, but we don't have a good way of determining what that is, right? So again, just encouraging that curiosity. Loss reminders are a little bit different, right? Loss reminders tend to be more conscious. These are memories or feelings regarding someone or something that has been lost. So this could be a child at graduation or at a performance feeling very sad because their parents aren't there. This could be somebody having a scar in their body that reminded them of a car accident that they survived, but a loved one passed away. This could be a holiday or a birthday of a loved one who has died, right? And so these are, again, are just some examples, but thinking about the calendar, right? When were my parents' parental rights terminated? When was I adopted? When was the last time I saw my uncle that I had a really good relationship with? Right? Those dates on the calendar or even the seasons, the month can produce quite a few feelings. So again, thinking about what informs our responses when the children in our care react to some of those things. Can we show up with empathy and curiosity, or are we just managing behavior? Where do we fall on that spectrum is an important thing to consider. So when we think about trauma-informed care, how do we show up in those moments to most meaningfully support the children and youth in our care? So some tips for caregivers include things like matching our expectations to the child's developmental age, not just their chronological age, right? So again, some of this is working on my understanding of what a 2-month-old is capable of. You know, I hear oftentimes parents complaining, right? Oh, my 2-month-old just doesn't know how to calm down. Well, they're not going to know how to calm down for another 3 to 25 years, right? It takes a while. Those regions of our brains that help us self-regulate don't fully develop until our 20s. And so expecting an infant to calm down on their own, they can't. They don't self-regulate. They co-regulate. And they co-regulate in the context of relationships with us. And so it's us stepping in to help them calm down rather than waiting for them to calm down. Mm-hmm. So meeting those developmental expectations with our own knowledge. And again, sometimes it's adjusting, right? We might have an older middle schooler that's having some developmental challenges as a result of whether it's their biology, whether it's their genetics, whether it's their lived experiences, whatever it is, right? And so we need to accommodate based on where they are rather than the number that connotes their age. Again, reminding us to focus on the underlying needs beneath the behavior rather than just the behavior. And I understand behavior challenges are difficult, right? And we're really focused on addressing problematic behavior. But if we never pause long enough to wonder why that behavior is happening, we don't address the need, we just fix the surface level expression of the need. So even if we get rid of the behavior, the need is still there, unmet, and they'll find a bigger, more challenging way of expressing that need because we haven't addressed it. Starting conversations with acknowledgement of a child's feelings models for them how to communicate effectively how they're feeling, right? It gives them the language to talk about what they're feeling. And sometimes it's not like, oh, I see you're feeling mad, right? But I wonder if you're mad. And that gives them a chance to correct. No, I'm not mad. I'm not mad at you. I'm mad that this situation's happening, right? Or whatever else. So again, having a little bit of curiosity and openness and allowing them to tell their story while giving them a little bit of scaffolding around that storytelling. Reassuring children that you're there to keep them safe. You care about them. They're important. For very young children, again, co-regulating, right? Staying close, speaking calmly. Young children may not understand what we're saying, but the tone of our voice, our energy, how anxious we are, is going to bleed over into how their brain is processing the world and how they're making sense of their experience. So sometimes taking a deep breath before we go and pick up that crying baby, right? Reminding ourselves why we're there and what function we serve for them. For older children, a lot of modeling or a lot of teaching self-regulation, mindfulness. Sometimes it's narrating, right? Talking about, oh, wow, I'm really frustrated right now. And geez, like before I explode, I'm going to actually take 5 minutes and just go for a walk. That really helps me. You want to come with me? And so next time they're mad, they feel like they're going to explode. They might say, oh man, I really need to go for that walk before I just blow my top. Can you come with me? Right? So it's creating those opportunities for reflection, for adjusting what our kind of trigger responses are. Right? A lot of times kids don't have good examples of working through difficult feelings, and we can't expect them to develop those skills unless we're modeling them, unless we're supporting them and developing them. So all of those pieces are really, really important. When we think about mindfulness for younger kids, right, sometimes it's doing exercises, right, reminding them to smell the flowers. And so we might have an actual flower and we're going to focus on the breathing in and what do we smell and what does that remind us of? Blowing out candles, right? Just asking them to, not with a physical candle, but just imagine you're holding a candle and you're taking your in breaths and out breaths really slowly so that you're not blowing out the candle flame by breathing too hard on it. And just slowly walking them through that. And some of those are available in books, some of them are available, like mindfulness meditation exercises are available for all ages on YouTube. You can look those up and use them if you don't feel confident in facilitating them yourselves. Some of these would even work with adults, right? What do you do with your big feeling? And sometimes it's helping the adults in the room that we're supporting recognize that they can benefit from some of these activities as well. And so just encouraging again to continue to approach with curiosity, with openness, with empathy, and with as much understanding as we can bring into these spaces, because again, the behaviors tell one story, but the true story is much deeper and much richer. And we have to stay curious in order to figure out what that deeper story is, especially when it's complex. A couple of resources before that I mentioned that I would love for you all to explore. The National Child Traumatic Stress Network, where a lot of the graphics that were used for today come from. There's a bevy of resources there. You can print them out and hand them out to folks. They're available for that. Certainly the Association for Training on Trauma and Attachment has quite a bit of content as well that's really rich and well developed. And before we wrap up our hour, and I pass it back for a little bit of housekeeping, I wanted to share a few quotes with you. One is this quote from Yuri Bronfenbrenner, who talked about the idea that in order to develop normally, a child requires progressively more complex joint activity with one or more adults who have an irrational emotional relationship with that child. Somebody's just got to be crazy about that kid. Right? That relationship, that's number one, first, last, and always. Relationships truly, truly, truly matter. This last quote is from Dr. Bruce Perry, who talks about the idea that the more healthy relationships a child has, the more likely he will be to recover from trauma and thrive. Relationships are the agents of change, and the most powerful therapy is human love. We're really just centering the idea that we started with, that relationships are the foundation for all development, is the idea that we're going to wrap up with today. With that, I'll pass it over, and thank you all for this hour.
Thank you so much, Dr. Sherman.